Good afternoon, and thank you for joining us today. Thank you as well to Dr. Roussin for joining me. I want to start by thanking all the Manitobans for their extraordinary efforts to roll up their sleeves, not once, but twice, to get vaccinated. Thank you. Right now, more than 81% of eligible Manitobans aged 12 and over have had at least one dose, and more than 76% have received a second dose. While this is very good news, we know there is more we need to do to protect Manitobans. The emergence of the Delta variant has changed things significantly. Now, public health officials tell us the pandemic is one of the unimmunized. Currently, there are more than 406,000 Manitobans who are not yet vaccinated. Of these, nearly 230,000 are children under age 12, and they are not eligible to be immunized. We need to do everything we can to protect them from COVID-19, especially as they return to school. Beginning tomorrow, people will once again in our province be required to wear masks in indoor public places. As of September 3rd, only fully immunized Manitobans will be able to take part in certain events and activities. We are introducing these measures to help protect people across the province and to ensure the healthcare system is not overwhelmed by a fourth wave of COVID-19. I'll now pass it over to Dr. Roussin to share more details.
Thank you, Minister. Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. So these new public health orders are being implemented that will require Manitobans to wear masks in indoor public places, and that will be effective tomorrow, August 28th. This includes schools across the province. And so in addition, the province has developed new requirements for individuals to be fully immunized to participate in certain events and activities. These requirements will come into effect by public health order on September 3rd, and these would be for all regions, and this includes requirements to be fully vaccinated to attend indoor and outdoor ticketed sporting events and concerts, indoor theatre, dance, symphony events, restaurants, both indoor and outdoor dining, nightclubs and all other licensed premises, casinos, bingo halls, VLT lounges, movie theatres, fitness centres, gyms, and indoor sporting and recreational facilities. This does exclude youth recreational support, organized indoor group recreational classes and activities, and indoor recreational businesses. Children 11 and under who have not been immunized will be able to attend events and activities with fully immunized adults. And again, these orders are here to try to reduce the transmission of the virus, as well as to reduce the future need for further lockdowns. We wanted to do whatever we can to avoid further lockdowns, and ensuring that only fully vaccinated people take part in some of these higher risk activities is one such method of doing that. So we can see that the great majority of our newly identified cases are unvaccinated. So today, 26 of the 31 new cases were not fully immunized. That's almost 84%. In the Southern Health Region today, 13 of the 14 cases identified today were not immunized, and that's 93%. These numbers are even higher if we look at ICU admissions. We see very few people who are immunized requiring ICU admission. So we're going to take these steps to protect those who are not immunized, especially children who are unable to be immunized at this point. We have to protect others in the community and the healthcare system from Delta. We can see in the jurisdictions around us the rapid climb in cases, which is equating into increase in demands on the healthcare system. So these changes we're announcing today build on our commitment to require all designated provincial service workers who have ongoing contact with vulnerable populations, especially children, to be fully immunized or undergo regular testing. So these individuals need to be receive their first dose by September 7th and their second dose by October 17th to be fully immunized by this set date of October 31st. So designated employees who are not fully immunized or cannot provide proof of vaccination will need to undergo regular COVID-19 testing, which could be up to 3 times a week for full-time workers. And of course, with that testing, you need to provide proof of a negative result. So again, I encourage private businesses and organizations to consider mandating COVID-19 vaccine for their employees to protect their customers and staff and to reduce the chance of an outbreak at their workplace. I'm urging the more than 177,000 Manitobans who have not yet been immunized to make an appointment today. There are many different places for you to go. Super sites, pop-up clinics, physicians' offices, pharmacies. If you need to speak with a healthcare provider, please do so. Get your questions answered. But we need as many Manitobans vaccinated as soon as possible in order to reduce the impact of this coming fourth wave. So visit protectmb.ca to find a location near you. And I'm going to turn things back to the Minister.
Thank you, Dr. Roussin. Throughout the pandemic, we've worked closely with public health to implement their recommendations, and we continue to do so. Manitoba's priority is to support every immunization opportunity that gives every eligible Manitoban the chance to protect themselves and their fellow citizens from the virus. This new public health order will support these efforts. Again, Manitoba is demonstrating leadership and taking more responsibility to protect more people who are not eligible to get immunized. This includes hundreds of thousands of children, youth, and seniors across the province. We want to thank all Manitobans for their efforts to roll up their sleeves, to get vaccinated, and follow current public health guidance to keep our case counts low. As we move forward, we're confident that even more Manitobans will be immunized to protect Manitoba children, themselves, and others at risk. Thank you. We will now take questions.
Will this also include employees and staff at all these locations? If we need to be fully immunized to go in to eat at a restaurant, do people that work at these places have to be fully immunized?
So not under these orders. It doesn't require that. Again, we're encouraging businesses to consider doing that, but these orders are related to people who can attend these facilities.
When you talk about indoor recreation facilities, is this pools, rinks? Can you just expand and make that clear for people? That's
right. So it's any indoor recreational activities, including pools, ice rinks. We've excluded this related to youth sports. We know the impact of these restrictions, especially on the mental health, especially on youth. So for now, we want to be able to offer these activities to all youth. Of course, if we start seeing a lot of transmission in these settings, we may have to change that.
We saw a lot of appointments being booked in BC for vaccinated after they did it earlier this week. Are you expecting that here? And do you have kind of a number, perhaps, of?
Well, we don't have a number. We are expecting that. We're planning for it, and we're certainly hoping to see this drive up those number of vaccine appointments.
Is there any consideration to expanding this to faith-based areas, like churches, weddings, funerals, stuff like that as well?
We've looked at a number of scenarios with this. This is what we've landed on at this point. We know those other settings do have a risk of transmission as well, so we're going to continue looking at other options.
Why did you reject that for places of worship?
Right now we looked at a number of scenarios with this, so we felt for announcement right now today, this was the set of rules that we'll bring in for now. Those other situations, we do have capacity restrictions, we do have other protocols in place, and then we still want to engage largely in that community to see where to go for future control.
Well, why are they treated differently because they're places of worship?
Well, we've always listed them differently in our orders, and so there is some difference in there, certainly under some constitutional protections as well, like that. So, so we're looking at it. These are our immediate announcements here, and I think if you compare us to other jurisdictions, these are from some very broad vaccine passport recommendations here.
Why wait till September 3rd?
Well, for the mass, we just do it immediately because there isn't much prep time that we anticipate for that. For the September 3rd, you know, these businesses often will have to get a lot of processes in place to be able to get this in order. So we felt we wanted to give them that time.
So for a mandatory vaccination for public service staff, will they be, or will the government pay for testing if they choose not to vaccinate?
So, you know, the implementation of that testing, all the details of that, we still have some time to, you know, to work on. So we're going to still be looking at what's the specific test we're going to use and which venue and who's going to be administering it. So that's all things taking place right now. So we don't have a definitive answer on that at this point.
You're confident that you'll be able to deliver all those tests in real time?
We are confident with that, but we're also you know, confident in the you know, the idea that this is going to encourage vaccine uptake. So, you know, the goal of this isn't to administer a lot of tests. The goal of this is to get many of these people working with vulnerable groups vaccinated.
What about enforcement? We've heard from businesses before that it came down to them having to enforce these rules. We saw people that were combative about it. What is the province going to do? Minister, this might be for you. What is the province going to do to help these businesses that are being left to put the onus on themselves?
Well, as Dr. Roussin mentioned, we have been engaging with stakeholders from many different sectors in the business, restaurant, and hospitality sector to talk about what makes sense and what is reasonable. We still have many options available to us around enforcement through the Ministry of Justice. You know, as you know, we had G-Force for security out, and we still have those options to use those security measures. So going forward, we will be talking with business sectors and other sectors in Manitoba about what makes sense and how we can help them in terms of implementation of these new restrictions.
What about people that don't comply? We've seen this in other jurisdictions, gyms in some cases, that said they're just not going to follow it. What can be done in those cases?
Well, that's why I think engagement is important, so that we hear firsthand how complex it will be to issue these new restrictions in those establishments and to help them to remove some of the complexities and to be able to roll out the restrictions. But we certainly have options available to us through the ministry and the Department of Justice to enforce. And we will, because our focus is to protect children and our vulnerable populations and to ask Manitobans to work alongside us to get vaccinated so that we don't have to use those measures, but we will if we have to.
For the places that require vaccination, will it be a hard and fast rule that you have to show your QR code either from your phone or your card, or will there be any other type of documentation that someone could show, including from somebody from out of province, or is it the QR code or nothing?
Yeah, and so for Manitobans, that's our goal, is that we have the QR code. That's what we want people to present. We do have a you know, a list of acceptable forms for people from outside of province or outside the country, but for Manitobans attending, we are going to expect that QR code.
But if you, I mean, time-wise, if you're talking about second dose, September 3rd, you got 100,000 plus people to vaccinate. They won't have their cards till past when the passports are necessary. You
get your digital almost immediately when you apply, so you can have access to a digital one. Certainly, some people that may not be you know, available, but for the most part, this is going to affect people and that they can get a digital card immediately.
Mr. Gordon, you talked about engagement. Today, James Teitzma was on social media engaging with his followers and talking about vaccines and mandates and requirements for proof of vaccination are akin to taking away freedoms, just as residential schools were. I mean, how can you engage with the public if a member of your own caucus is engaging in such a way that is, you know, questioning the authority and the the validity and the veracity of the science behind.
My focus as Minister of Health and Seniors Care is to work with all Manitobans and MLAs and cabinet ministers and leaders of the opposition to ensure that they understand the importance of encouraging Manitobans to get vaccinated. It's about protecting our vulnerable populations, our children, and that is my focus, is to ensure that everyone comes on side and buys in to ensuring that vaccination rates are increased.
So will you be speaking to him?
I speak to all stakeholders, members of the Legislative Assembly and our caucus and our cabinet, and I have open and honest dialogue with all individuals about the importance of vaccination and keeping Manitobans safe.
Okay, just related to that, Dr. Roussin, one of the things that James Teitzma was commenting today on was what he was telling people, you're at a greater risk of getting infected with COVID at a Bomber game with people who are vaccinated than having a couple of unvaccinated people over to your house. Can you comment on that?
Well, I would just say that being fully vaccinated dramatically decreases your chance of being infected. If you are infected when you're vaccinated, our evidence shows that you're much less likely to transmit that to others. And then we can see that if you're doubly vaccinated, your chances of a severe outcome is dramatically reduced as well.
So he's right?
That's what I'm saying is, if you're vaccinated, if you're around fully vaccinated people, the chances of any of them having disease is much less than people who are unvaccinated. And if you are doubly vaccinated and do happen to develop COVID, you're much less likely to transmit that to others. You have a lower viral load. So,
Got a question over here.
Minister Gordon, we spoke to the Mayor Winkler this morning, and he said that vaccination passports and proof of vaccination and mandated vaccinations are simply wrong in his opinion. They drive, separate and segregate people, as Mr. Teitzma alluded to this being similar to what was done in residential schools, saying that there would be a truth and reconciliation needed in the future following these kind of public health orders. First, how do you react to that? Second of all, have you given your mind to Southern Health, where the case counts are high, the vaccination rates are low, and the political leadership there doesn't seem to be on side with these rules?
Vaccinations are available to all Manitobans, not just sectors of the province. So we're encouraging all Manitobans to get vaccinated. Individuals that work in the public sector, we are asking them to get vaccinated and show proof of vaccination, or go through regular and consistent testing to show that you are negative for the virus. So this is being applied across the entire province. The focus has to be on protecting vulnerable populations, our children. We see the numbers, hundreds of thousands of children going back to school in the fall. We want to ensure that they are protected and they're safe. That is our focus in bringing forward these orders today, and that will be our focus going forward.
Are you committed to a legal challenge if it arrives?
In terms of your comments regarding Southern Health, we may look at a regional approach down the road, but at the moment, we are focusing on just encouraging all Manitobans to get vaccinated. Roll up your sleeves, help us to increase those numbers and protect everyone who's at risk.
I've seen a small number here, Mr. Gordon. I just have a quick question and change gears a little bit here. Recently, Aaron O'Toole, leader of the Conservative Party of Canada, says there needs to be a health approach to the drug crisis that's happening here in Canada. As the health minister here in Manitoba, would you echo that sentiment, saying that there needs to be a health approach to the opioid crisis and the overdose crisis that we're seeing in the province, as opposed to a criminal approach?
Well, certainly, I've always said that physical health is not the only health. There is no health without mental health and a strategy to address overdoses. And we have been able to work very collaboratively with our federal counterparts to bring forward funding to address the needs of Manitobans here in the province. We will continue to work with all levels of government, municipal and federal as we move forward.
Advocates have said that the supply in the city is becoming more toxic due to COVID-19. Would the provincial government be willing to have a conversation with the federal government about a safe supply for Manitoba in terms of substances like methamphetamine, heroin?
Well, we have been having many conversations about best practices and what is the right approach. There's certainly no one-size-fits-all jurisdiction, so we have to look at what the needs are of our particular province. And we've had many discussions and will continue to be open to having more.
All right, with that, we actually just go to the
Can I just get one more question?
we'll come back to this
Okay.
after the
My
questions from the
apologies.
radio, so that we'll just go to the people on air. Paul?
Thank you. Thank you, Minister. Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. What's going to be happening if a business won't enforce the fully immunized rules?
Well, these are going to be required under the public health order, so there will be an ability to enforce if they're not followed.
Thanks. And many businesses are going to be experiencing a bit of a financial hit with these new regulations. What's going to be done for them?
Well, I mean, I would indicate that the purpose of this, where we have the vast majority of adult Manitobans are fully vaccinated. The purpose of this is to be able to not further reduce capacity in these places, and really moving forward, do whatever we can to not have another lockdown. This is a method to keep these facilities open without restriction, really, other than the need to be vaccinated, to the vast majority of adult Manitobans.
From the Brandon Sun, Kimberly.
Good afternoon. So I'm just wondering if you're going to be changing the alert from orange to red after today's announcement.
No, we don't have plans to change the PRS after today's announcement.
Thank you. So with the Americans being allowed to come north now, how will they be checked if they're doubly vaxxed at those facilities that you just described that will be open to doubly vaxxed Canadians?
So we're going to provide advice to these locations on what would be acceptable proof of vaccination from outside of Manitoba. When you're talking about those coming from the U.S., they're already vetted by Canadian Border Services. They need to be doubly vaxxed, so we'll be providing advice on that.
From CJOB, Rosanna.
Hi there. I was wondering, will there be enhanced enforcement in areas with low vaccine uptake, especially where historically many people have disregarded the public health orders, like wearing masks indoors?
I think enforcement's been a tool available to public health. We've never stopped messaging. We've never stopped incentivizing things like vaccination. So there'll certainly be enforcement. And, as we move forward, again, we're doing whatever we can to avoid another lockdown, doing whatever we can to avoid overwhelming our healthcare system.
Thank you. I know you said you would consider bringing in regional mandates, but would you consider regional travel bans similar to the ones in cases of fire risk if COVID-19 cases spike in those areas?
Well, we've had the travel restrictions related to the north in the past. As of right now, a travel restriction to other geographic locations is not something that we've really considered.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin and Minister Gordon. Some countries in the world are trying to make the test to make people pay their COVID test to encourage more vaccinations. Is there something that it is on the table in Manitoba?
And sorry, I didn't catch what were we doing about the testing?
No problem. I was saying that some countries in the world are making people pay their test to encourage more vaccinations. Is there something that could be implemented in Manitoba in the future?
I don't think we have something, any specific plans on that. On these, there's lots of considerations. If we're talking about, people who are symptomatic, we certainly don't want to discourage people from getting tested if we want them diagnosed and be able to contact trace and things. So there's a lot of things to consider. I don't think we have anything specific in the works on that, but we always look at what other jurisdictions are doing and the successes they may have.
All right. And I maybe didn't catch that, but what is the herd immunity today with the new projection of Delta variant?
Yeah, and so, herd immunity is a concept that's thrown around. We've talked here that at the very basic level, the calculation of that is 1 minus the inverse of R naught. So just basically the higher the R naught, the higher the amount of people a single case transmits to, then the higher that vaccine status would be for. Be required. So for a wild type virus, this R naught was about 2.5. Now for Delta, it's much higher, probably double or more than double that, which means we need a much higher vaccine uptake to reach that herd immunity. The other thing the concept of herd immunity assumes is an even distribution of that vaccine uptake. And so if you have a very high uptake, however, have pockets of very low uptake, you can't really reach a herd immunity that way because you have geographic areas where you have high transmission still.
From the Canadian Press, Kelly.
Hi. So Manitoba really was the first to bring in a vaccine passport, but now after, other regions this week announced they'd be bringing in actual restrictions for those without both doses, now we're bringing them in. So why didn't we act faster when we actually have the infrastructure in place?
Well, we did act. We did have a number of circumstances where we've utilized and required vaccine. We've done this for the large sporting events, a number of large events too. So we're acting early in the fourth wave compared to these other jurisdictions. We know our numbers right now are relatively low, although we see some high test positivity in certain regions, and we know that fourth wave is coming. You can see it in other jurisdictions. So we're acting, fairly early on this regard, and we've always been utilizing that card in one way or another.
And when it comes to the regions where you're not really seeing a lot of uptick in vaccination for, the multitude of reasons that you might see people, how are you going to balance at this point maybe education with non-compliance for businesses or people that are not following en masse this kind of requirement?
So, I think that there's the public health approach to anything is a multifaceted approach. So, so certainly education, certainly providing the data showing that our hospitals and ICUs are not filling with vaccinated people. It's unvaccinated people, showing the safety and effectiveness of that vaccine, and in other incentives. We've had the incentives of the lottery. This is a form of incentive. We're going to require vaccine to enter some of these circumstances. And I think that it's also about respecting and listening to the concerns that people have related to the vaccine, trying to relate and trying to understand and provide the opportunity for people to get vaccinated or at least ask their questions on here. So, and that's being done as well. So it's a multifaceted approach. It's challenging. We've been able to vaccinate the vast majority of Manitobans. but you can see that Delta's forcing us to ensure we get that rate higher.
We now return to the news conference theater.
Roussin, when it comes to youth sports, you said that the youth would be excluded, but will coaches, staff, refs, and parents attending these events also need to be fully vaccinated, or are they excluded as well?
No, they will need to be fully vaccinated.
And what about masking in those when it comes to the sporting events as well?
So masking indoor public places, yes, there'll be an exemption for people who are actively participating in sports.
Same like gyms, it would be the same as before, even while you're at the gym, you'll need to wear a mask.
That's right. They'll be required to be fully vaccinated.
Or everyone at a Jets game is going to have a mask on.
That's correct. At this point, to be fully vaccinated and masked. At this point, we'll see what the orders look like when they do return.
I believe I have one more question in the middle here.
Yeah, I just had one last follow-up about harm reduction, and my apologies, but I appreciate the time today. You know, at this point in time in Winnipeg, there is a very real conversation happening about a supervised consumption site. You know, would your government and as health minister today commit to supporting that site both financially and with whatever resources you might be able to offer from Manitoba Health?
Our government is committed to ensuring that individuals get the care they need who are struggling with the challenges of overdoses, mental health, and addictions. That's why we created this new Ministry of Mental Health, Wellness and Recovery, so that we could have a focus on addressing this issue. That's why we have committed $50.8 million since the Virgo report was released in 2018. We've launched over 30 new initiatives. We continue to speak with stakeholders, providing services in the community around overdoses and addiction supports, and we'll continue to work with them going forward.
And my apologies, but supervised consumption site, provincial government, will you support it? Yes or no answer?
Well, I'll say that I recently launched a very comprehensive consultation plan where we will be talking to stakeholders across the province about what makes sense in terms of a service delivery model, what types of programs and services are needed. And so we are open to discussing all the options that come to the table. And once the action plan is released at the end of the year, we'll see what it includes.
Just some clarification. You have to wear a mask at a gym even when working out?
No, when actively engaged in an activity, then you can remove that mask.
That would include not having to wear them playing hockey or whatever.
That's correct.
Okay. Yeah. Just going back to the Southern Health and the regional approach. So we go back to, I think it was Wednesday. There was 105 cases. 43 of them in Southern Health all were unvaccinated. Today, it comes out that 13 of 14 are not. I guess for both of you, maybe why are we waiting on a regional approach at this point? Like you're seeing what happens when people aren't vaccinated and how the cases are spreading. So why are we waiting in an area that is primarily not vaccinated?
So I think it certainly is concerning what we see there with the numbers, with the test positivity that we're seeing in Southern, and then couple that with the lower vaccine rate. So we are looking into that. We've right now, these restrictions will apply there as well, all these vaccine requirements and the mask mandates. So we are acting, it's provincially. And then we'll, in the coming week, we're going to still be looking at whether a regional approach is required and what that could look like.
Minister Gordon,
I just have a couple more questions, sorry to interrupt.
This would be a chance for you to speak directly to people who in reaction to these health orders will be angry, very angry. We've alluded to a member of your own caucus and mayor of this community. What do you say to those people that say the government has no right to tell me what to do with this kind of health issue?
That's a very, very good question. And I want to answer it by sharing a story, if I can. This summer, I was in my constituency, and I was in the neighborhood, and I ran into a family. And they had a little girl, and she came to me as we were engaging, and she said, "Audrey, I can only play with my friends through the fence." And I think that speaks volumes to what we need to do as Manitobans to protect individuals like this little girl who is at risk because she's under the age of 12 of getting COVID, and ensuring that our healthcare system is not overwhelmed. So I say again, if you're sitting on the fence, perhaps you're out at the lake in the summer, or you just you want to do it, but you're still unsure of timing, the time is now. And we need to increase the vaccination numbers in our province. Roll up your sleeves, get vaccinated, help us to help all the individuals that are at risk and to help our healthcare system.
James, time for one more question.
Dr. Roussin, you mentioned nightclubs. I'm just wondering about, will people be able to dance now? I haven't seen forward.
So this is what the benefit of this system is, that in these areas that have mandatory vaccine requirements, we're not putting any other restrictions in place. So we can have the vast majority of adult Manitobans taking part in the activities without restriction other than the requirement to be vaccinated.
What is the timeline for how these orders are in?
Sorry, so masks, indoor public places, we still are going to keep that just as a multi-layered approach.
You can dance, but just wear a mask.
Yeah, you're right, yeah. And
How long these orders are in effect till as of now?
Okay, we'll do last question.
so the masks will be in effect starting tomorrow until revoked, and the orders on September 3rd will be in place until revoked.
Just to confirm, are you saying you're going to come back within a week to tell us about regional measures?
I think we have time for questions.
Yeah.
Not the. I mean, we're out in next Monday out there, so there's nothing confirmed about a regional approach. But you know, as soon as we land on something, we will obviously inform people.
Why are we waiting when you said you talked earlier about even if you have high levels of vaccination rates, if you've got these pockets of really low take up, it basically scuttles everything. So why would you wait?
Well, we're concerned, and we're looking into that, and so you know, we're going to take the steps necessary. So we just haven't had it in place on these orders. I think these are big moves by Manitoba to protect Manitobans, and that regional approach, we're still looking at it.
All right, thank you very much, folks.
Thank you.